Thank you so much. Hi, everybody. My name is Aasta Mehta. I am one of the other co-chairs for the policy core at Amethyst. So glad to be here. And that was such a great conversation. Thank you, Sally, for having that with Rep. Underwood. I'd like to, I think that the session really, I saw a lot of hearts and cheers and things like that. So I know a lot of what Rep. Underwood said really resonated with so many of you here today. So I'm here to continue the conversation with actually a great friend of mine. I'm pleased to welcome Anjelica Sanders, who is the Chief of Staff to the Pennsylvania State Representative Morgan Cephas, a policy and communication strategist for more than 15 years of experience in public health, public policy, and community engagement. Anjelica has been instrumental in advancing many of the initiatives and accomplishments that have defined Rep. Cephas's leadership in the Pennsylvania House of Representatives. Since joining Rep. Cephas's office in 2018, first as a policy director and now as chief of staff, Anjelica has helped lead work focused on health equity, maternal health, and social justice. She played a key role in the statewide opt-in PA campaign extending postpartum Medicaid coverage from 6 weeks to 1 year, supported passage of the Pennsylvania Dignity for Incarcerated Women's Act, and helped launch the PA Black Maternal Health Caucus to address the maternal mortality crisis across the Commonwealth. Before entering public service, Anjelica managed community health initiatives at Einstein Healthcare Network, including the award-winning Health Beauty Connections program. She holds degrees from St. Joseph's University and North Carolina A&T State University, and is also founder of the Elevate Bar PHL, a wellness community promoting movement, health, and community engagement. Please join me in welcoming Anjelica Sanders as we continue the conversation that we started with Rep. Underwood. So thanks, Anjelica, for being here.
Hello, absolutely. Thanks for having me. It's always a pleasure to connect and get together. So thank you.
Thanks. So Angelica and I go way back, but we are going to have a little bit more of a formal conversation today, Angelica. So if you can share a little bit about, what your sort of initial thoughts were about what Rep. Underwood shared with us about what's going on federally and how folks can interact with federal lawmakers, but maybe bringing it back home to individual states. I know a lot of the work in terms of policy happens at the state level. And I know that a lot of, researchers across different states have different legislators to contend with and things like that. So if you can share a little bit about what your initial thoughts were around the fireside chat, and we can go from there.
For sure, for sure. Thanks again for having me. I'm happy to be here on behalf of Representative Cephas, who couldn't make it, but sends her regards and obviously always appreciates these type of convenings. So we did have a chance to take a look at the remarks ahead of time, and then I was glad to be able to look at them again today with you all. And I will start by saying Rep. Underwood has me fired up all over again. It's really exciting in a way to hear the progress or the impact that they're able to make at the federal level, even considering, the state of the times that we're in. But that is what I've always appreciated about working and being at the state level. It feels like we're able to get more done and be intentional for the Commonwealth of Pennsylvania. But I would say that in seeing her remarks and a lot of the points that she was making, I would say that a lot of it is the same for us here in Pennsylvania. When we founded the Black Maternal Health Caucus, it was because when you're talking about women's health, when you're talking about reproductive health, we really had to be strategic and intentional about bringing the conversation to maternal health because we knew and we understood that maternal health, unlike some of the other issues that touch maternal health, undoubtedly touch maternal health. But we knew that maternal health in general is a nonpartisan issue. Rep. Underwood even mentioned, she said, almost no one can say, you don't want babies to come home healthy, that you don't want mothers to survive. And so in founding the caucus, it was directly behind that point of having this laser focus on maternal health and Black maternal health with the Black Maternal Health Caucus. And we've seen very similar interests. We've seen bipartisan interests. We have um, Republican and Democratic members of the Pennsylvania Black Maternal Health Caucus. We now have members of the Republican caucus who are spearheading and not just co-sponsoring, but lead sponsoring legislation. We are attending meetings together, having policy hearings. And so we see at the state level, we see that bipartisan effort and support. And so that's something that we want to be able to leverage. And because so many issues do touch maternal health, what maternal health and Black maternal health has been able to be for us at the state level is a entryway, is a door opening to some of these other issues, whether it be things like housing and overall healthcare access, because we know we had to extend Medicaid from 6 months to 1 year postpartum because it's not just about the time that you're pregnant and the time immediately afterwards is much larger than that. And so maternal health has been able to be an entryway into those points. And I'll end with this. What we're also seeing similarly at the state level that she mentioned at the federal level is funding and investments. Even when policy and legislation can take the time that it does, we have seen some funding that has been allocated to the issue. Not as much as New Jersey, we always mention that, but in some other states, but but a starting point and a part of the strategy. Because if we can get funding behind some of these issues, sometimes it's looking at them as a pilot program that can turn us into the long-term legislative impact. And to that point, I know that a lot of the federal legislation is not moving, but here in Pennsylvania, we are glad to say that a lot of our bills have been able to move. Last session, 5 bills of the Pennsylvania Omnibus made it from the Pennsylvania House over to the Senate. 2 of those bills made it to the governor's desk. Just over the last month, another 2 bills related to midwifery care are made their way to the governor's desk. And so we are seeing legislative movement at the state level that I do not think that they're seeing as much of at the federal level.
Thank you, Angelica. I mean, I think to piggyback off of that, we have folks here that are working in different states and are trying to sort of do that kind of legwork in their states, talking to lawmakers or probably talking to people like you, right? Like chief of staff that are connected to lawmakers and others. Can you provide, sort of thinking about how things have been successful in Pennsylvania around moving bills, how can you give us some concrete examples of like what do you look for in that room when someone's coming to you with an ask, and what are some ways that we can that folks can frame their work so that there is a possibility for ongoing conversation and potential movement of some of these things?
Sure. So 2 things come to top of mind, and one is not being afraid to meet with staffers and team members, right? A lot of times requests come through people like me to meet with the legislator and meet with the legislator, and meet with the legislator again. And Rep. Underwood mentioned it. She was like, if you're coming to the legislator, I need these 3 bullet points, not even and it was funny to hear her say that. She said, not even double-sided, right? And that's because of, just the way that things are set up. And so what you're able to do when you build relationships with chiefs of staff, policy advisors, policy analysts, whatever the title is on the team, when you make those connections and build those relationships, you have a little bit more time to get into the nitty-gritty. Oftentimes, she mentioned research analysts that, they're the ones getting into they can speak your language, your research language. Um, I have a little bit more time to, read through the reports, but I will, say that to say that one of the first things Representative Cephas, the Pennsylvania Black Maternal Health Caucus, a lot of the legislative work that I've been a part of is very data driven. So we absolutely need what you provide. But the first thing that I scroll to when I get a new report is I look for a recommendation section. I set time aside to read through the entire report so that I can answer the tough questions and prepare the rep or the members for, whatever it is that they're trying to do. But but two, my time is limited. And the first thing I'm doing is trying to find out if there's a recommendation section. And what I appreciate most about the recommendation section, just for instance, um, all of the maternal mortality review committee reports. That's something that we look for every time that they're released at the city level, at the state level. But the first thing I'm doing is scrolling to their recommendation section. And so I definitely appreciate when that research has already been translated into recommendations. What does that look like? And understanding that, some researchers are, in the nitty gritty of the research, wherever the time comes in the process where that can be translated in being the starting point of conversations with staff, with legislators, I would say that that is top of mind.
I think that's such a great point, right? Like, we just assume people when we share data that people can interpret that to be like, this is what needs to happen next. But I think like saying concretely, this is what needs to happen next in one of those bullets that Rep. Underwood had talked about could be really helpful as you're sifting through so many people's asks and so many priorities around all kinds of things, at your level. So really appreciate that. So I don't want to take over the conversation. So really want to open up some time for folks in the audience to be able to ask questions. I don't see anything in the Q&A, but we're all fam here. So if anybody wants to raise their hand and ask a question to Anjelica, she is a wealth of information. Like I said, we go way back and have had many, many conversations about so many things. And so really have learned a lot from you, Anjelica, about how to, be able to effectively communicate with lawmakers and do that in a way that can really lead to some kind of actionable change, which is ultimately what we're all here for. So I'm going to open it up to the audience. Does anybody have any questions? And it's hard for me to see people's raised hands. Oh, okay, Wanda, I see your hand is up. Please.
So, with all the pearls of wisdom that you have and all the people that you meet each and every day, I'm wondering what is you know, needing to be really cautious about maybe triggers and how we state things and when we're trying to meet with the chief of staff, what might be strategies to get on your calendar?
Oh, yes, great question. And I would say, I mean, I receive phone calls and emails every day. But when we talk about strategies, I have found myself having to tell people that I appreciate that they reached out for a fourth time. Not because I ignored the first email or didn't want to get back to it or any of that, but because, it got lost or there's, a delay in our ability to get back to you immediately, but it is for sure of interest. And so I would say to not be afraid to reach out, the cold calling, the cold emails. Sometimes when people are a part of particular types of coalitions, I can tell because they call the office and say, who's the person I can request a meeting with for X, Y, and Z, right? And so not afraid to make that request or directly ask for that contact information from even, people who are not in my position in the office who will give you the right email address and you'll send it and you might call again and say I sent the email last week and I tell people to charge it to, and this is my experience, but obviously I have colleagues and we work together and we get a lot of requests and we have to prioritize them, and Yeah, and we have to just make time, but it is still, yeah, and still a lot easier to get onto my calendar than it is on the representatives. And just have that initial conversation. And the way that we operate, Rep. Cephas and I, it really is helpful to have that initial conversation, so that we can have a starting point when we get in front of the legislator, be a little bit closer to an action step than just a cold conversation about an update or that type of thing. So I would say do not hesitate to be persistent, and please, most times, I can't speak for everybody, but don't charge it to they're ignoring us and they don't want to talk to us or anything like that. The work is real in that sense.
Thank you.
That's
Appreciate that.
That's a great question, Wanda. I think we get like nervous, right? Oh, they don't want to talk to us anymore, so we're not gonna. But I think Angelica's point is just to keep on keeping on, and eventually, someone will reach out. So that's really great advice. Thank you, Angelica. I
Right,
have,
and I'll
yeah,
I'll,
go
I'll
ahead.
add to that really quickly, Asta, because it's particularly with the Black Maternal Health Caucus, we have other ways to engage. Not every issue and every topic has other ways to engage, but we do have other ways to engage because you might just have a question about where we are with legislation, but we have been able to put together a hub of information so that some of those basic questions can get answered. And so I would add signing up for email lists and that type of thing, whether it be the caucus, the legislator, even if it's not your legislator, you may be surprised of the type of information that you get, and the opportunities that you see that way.
I have a follow-up question because I think there's the reach out and then there is at times when you need support from the constituents. And when are those opportunities that you have a call out that we can show up and support to move forward a recommendation that you're doing so that it really is coming from the community and constituents to support and forward that message?
And so you're saying when our constituents reach out to us and they need particular types of support, is that what you?
Or when your representative is in need of support of their
Mm,
constituents to help move something forward, like when are those opportunities and how is it something that comes forth in your newsletter? Like, I think that there are times when maybe you need either testimony
mm.
or, they're at a community event, so showing up matters. Like, how is it that people should be more like alert and aware of those opportunities? Because they're just as important for the work you're moving forward.
Absolutely. I would say that the relationships are really the best point for that. And so just for example, you mentioned testimony. If we need testimony, we're calling people like Asta to connect us with somebody that she's worked with or somebody that she's touched, because oftentimes it's not even enough time to put out an email and wait for a response, unfortunately. So when those relationships, and that's why I will meet with anybody that I can. We get contacts all the time. Somebody's like, "Oh, I'm working on this," and I want to make time and find time to meet with you, even if we don't have an actionable step in this moment. You need something from us, or we need something from you, because now I know that you're working on X, Y, and Z, and when the time comes, I know that that is a dot that I can connect. And so you're working on a new service, or you invented a new product. I might need testimony for innovative products that we can look into, or invest into from the state level. But I would not have known that if I did not have that initial meeting. And so really pushing for those, and like I said, particularly the way that I go about my work is really trying to get as many of those meetings as possible, even if it's just this is what I'm doing, this is where we're at, this is how you can stay engaged. You might get a call from me randomly one day. So I would say that.
Thank you, Angelica. We do have some more questions in the Q&A. So the first one is, can you describe one successful campaign to change the law? How did it start? What were key moments, and what might we learn from it?
Sure. So I'll go to Optin, PA, one of the first because that was a full out campaign. And ultimately, even before federal funding became available or this option became an option at the federal from the federal level, Representative Cephas had introduced legislation in Pennsylvania based on recommendations from experts like you all, that we needed extended coverage for people who are giving birth in Pennsylvania. And so we introduced the legislation. And I'll break it down this way. The way that we try to look at every policy issue is attacking it from as many sides as possible. And there's three sides that we're looking at. We're looking at the legislative side, we're looking at the policy and administrative side, and we're looking at the funding side. And so we introduced legislation, but we also, Representative Cephas and myself and her colleagues, called for meetings with the administration, with the Pennsylvania Department of Human Services, who is in a position to make a decision or create a policy with or without state legislation on this particular issue. So the department could have woke up on a Tuesday with or without legislation introduced or being passed and said, we want to extend Medicaid coverage for postpartum care. And so we had those conversations to get them to understand why they should wake up next Tuesday and do that. And then on a random Friday, with with COVID and ARPA funding and things that were happening during that time, the federal government, who manages Medicaid at the federal level, or where the regulations come down from the federal level, said, look, states, you all can extend Medicaid coverage if you want to for postpartum care. And so by the time that option became available, and I emphasized that it was an option, that states did not have to do this, and some states did not, many did, but some states did not. By the time that option became available, it was absolutely no effort that we had to put into getting the Department of Human Services to make that decision. And still, the bill had not passed. And so we were able to make that change and see that law change because we were very intentional about bringing it all together. And if the department had not been aware of the impact that extended coverage would mean for Pennsylvanians, if we had not had some of those conversations even before this option became available, it's our understanding that Pennsylvania would not have moved so quickly. We may have still been able to be successful at it, but it may not have moved so quickly. To that end, the law still has not changed, because that was an option. The states were able to opt in. And so we still do have a proposal to, now it's not to extend coverage, but it's to codify the coverage that currently exists, so that, hopefully we don't see that change or revert back to, where things were before. And so even with actual bills that we got passed, doula Medicaid coverage for doulas care, which took 6 years. We're always seeing, we're going to introduce a piece of legislation, but we're talking to the administration and the departments about what they can do with or without legislation, or seeing what they can do. Sometimes they can do things, sometimes they can't. And we're trying to find funding for it, whether it be at the federal level or the state level, so that at the end of the day, on the ground, the community can feel a change, whether it takes 9 years to pass a bill or not. And so I would say the Opt-in PA campaign is, top of the line for me for that. But we've used that same strategy for other bills that have been successful.
I really appreciate you sort of sharing that. While the law, I think that's the thing, is like, I think people focus that changes have to happen only with laws, and like how this was, while yes, there was legislation, and that's like what, allowed you all to sort of rally around a topic and like understand the nuances of that. Yet it was the policy change that was the thing that just happened administratively, or it was an administrative change, but the engaging with legislators to allow that administrative change to happen was what was so it's which was so successful. And I think that's where people sometimes don't understand that like it doesn't have to be the law, but talking to lawmakers can make changes happen anyway. And that, and so as you think about sort of maybe some unpopular, not unpopular, but like controversial types of things, right? Like maybe the avenue is still like talking to certain lawmakers, but really the change happens somewhere else, right? Like as you think about sort of some of the work that we do, sometimes that sort of straddles some controversial topics. So thank you for sort of highlighting that, that in Pennsylvania. We have
For sure.
one last question, and
Mhm.
then we'll pass it along to the next session. But the question is, do you have suggestions about ways that are helpful for researchers in building a relationship and like being not irritating or a burden with key legislative staff, even in advance of hard policy recommendations?
So recommendations on building the relationships, is that
Yes,
correct?
yes.
Okay.
Hmm.
Um, Yes, I would say to reach out. Don't be afraid to reach out. And even when I say reach out, I don't just mean, calling and emailing, but when you're in rooms, like introducing yourself, and making those connections. I love when somebody sends me a report, whether it's something that I'm working directly on or not. Hey, here's the latest findings, or here's what our recommendations on X, Y, and Z, because now the way that I operate is now it's in my filings, and if and when I get to that topic, or when I need to delve into that topic a little bit more, I have that point of reference. And I think a part of the question was like, without being like irritating, hopefully, like me, people love the work that they do. I'm not, yes, I'm like, oh, they emailed again, right? But I literally, by the time I'm talking to you, I will thank you for emailing again, because we may not have connected if you did not, because that first email may have gotten lost in the sauce. The second one may have gotten um, set as a draft, or, something else is, going on. Because, I work on Representative Cephas's policy, but I also manage her team. We have constituent services, and our constituents need a lot of help and support. And so I would say just remaining flexible in what that looks like, because I'm sure it looks different for everybody. And yeah, and just, being kind, and giving like those soft nudges where possible.
That's great. Thank you so much, Angelica, and thank you so much for your really great insight. I think that's like so helpful for all of us to hear, just how we can make so much of this work is at the state level. And so really appreciate your insights there. And so I believe,
Absolutely.
yeah.